Welcome to Health Tech Hustle. We exist to share stories of the brave entrepreneurs helping to solve the most important problems in digital health today. We interview top leaders in health tech and bring them onto our show each week to listen and learn from their story. With your host, Rodney Hu, founder of 209 Digital.
Hello, and welcome to another episode of the Health Tech Hustle podcast. Today, I'm joined by another special guest, Mr. Muthu Krishnan. He is the CEO and president of Cancor Health, and he has 16 plus years of healthcare experience. Cancor Health is an AI-assisted patient engagement platform that brings compliance care, content, and communication together to deliver quality outcomes at reduced cost. So with that being said, I'm excited to have Muthu on and learn what they're doing at Cancor Health and just kind of pick his brain on his journey. So with that being said, welcome to the podcast.
Thank you, sir. Thanks, Rod. Really appreciate your time and excited to be here.
No problem. So yeah, let's just jump into it. Why don't you give people a brief background of who you are and how you got into the healthcare industry?
Excellent. So as it always goes, it was totally an accident for me to be in healthcare for 16 years. And now I think of it, after 16 years, I can't think of anything other than healthcare for every 30 seconds. That's where I think one of the very few vertical healthcare does it for you is the satisfaction, and you're touching the patients or the care team, the frontline workers, whether it's physicians or medical assistants, physician assistants, or the nurse practitioners, and connecting with the patients, whether you come out with technology platform, a tool, or electronic medical record, the satisfaction, immense satisfaction in one way or other, you're serving the community, that you can really feel only in healthcare. So 16 years ago, I was through a consulting company, through Deloitte and one more consulting company, I was put in with Kaiser Permanente. And that's where my healthcare journey started. Then implementing the EMR systems, working with physicians and IT and the business folks. And that really put me into healthcare systems and understanding the healthcare processes and technology and innovation. And now it's already 16 plus years in healthcare, as you rightly pointed out.
Nice. And so you've been with Cancor Health for over 4 years now. And can you kind of walk us through the journey on what it's like to build that company and what is the purpose and the mission behind Cancor Health?
Sure. Cancor Health was formed at 4.5 years ago. And one thing Kaiser and other places taught me is the electronic medical record and how the technology can be an enabler for the physicians group and the care team members of a hospital or a clinic. What is been missing is the patient engagement, connecting with the patients in a simplistic form factor. One thing I realized during this journey is whether you're a highly educated personnel, whether you're a high court judge or you're a very PhD in any form factor, or a double masters or whatnot, when the people getting older, they become like a kid, right? Mm-hmm. When we started this journey, we want a simplistic form factor to create a platform connecting the patients and the care team. So we created the platform. Being in Silicon Valley, AI comes naturally for us. So AI-enabled patient engagement platform connecting the patients and the care team. We are very, very particular about the ease of use. That means the platform should be very simple to use. And same thing on the care team side and the hospital side. They should be able to see a dashboard of what patients are, how are they doing, whether they're chronically ill, and how can we facilitate the connectivity between these two entities. That's how we started this journey. And connecting with the electronic medical record is nowadays whether it's a clinic or a medical facility or a hospital, everybody has a medical record. It started during the Obamacare era, and it's now everyone has an electronic medical record to associate. So we had to connect the data back to the electronic medical record systems, and we are very familiar with that. And that's how the journey started. And what we learned during this journey is tremendous learning and how to engage with the patients, how can be a simplistic tool for the patients to use with one click. You're going to miss anybody attention if there are going to be multiple clicks. They're going to lose their interest. So we have to keep today Cancor is successful with 85% to 90% patient engagement. It's really a lot of learning during this 4 years or 4.5 years time, right? So that's one thing we are very, very particular and adamant about, being a simplistic platform with better patient engagement, connecting the patients and the care team members.
Nice. So you guys created this AI-enabled patient engagement platform. And how did you guys go about determining the need for your product and service? And how did you go about testing whether or not people would be interested in even using your service?
Very good question. I'm going to answer it in two folds. The first one is we had key opinion leaders, we had all the industry experts. When we started this journey, we were focused on cardiology because the fund we raised, the investment we raised, are all from the doctors, and we cautiously took the money. When I had this an idea stage in the PowerPoint deck, the investors invested in this venture is all from the doctors, physicians. We call it a smart money because we want them to invest and also thrive, taking this company like a product evangelist, try to test that within their own facilities, which exactly happened. So they are the key opinion leaders, according to me, where they gave suggestions. They talked about how the congestive heart failure was the first diagnosis we started with for reducing the readmissions. They gave some ideas. So we developed the product with those ideas and the workflows on the clinical content. Number two, we took our beta testing in a place called Roseburg in Oregon. It's a remote place where technology is not easily available like in Silicon Valley. It's completely different over there. And the Wi-Fi or the hotspots are not available. So we cautiously took that set of patient population in the remote place. And we were successful in the first beta testing with 75 to 80% patient engagement. So that's how we tested, and we were engaged. We tweaked the product, and we had better and better working with those. Once we are successful with that, we were able to bring it to the normal population where places like Silicon Valley or metros, cities like San Francisco or Washington, D.C. or Philadelphia or Pittsburgh and so forth. That's where we started the journey.
Awesome. That's crazy because you said 75 to 80% patient engagement. That's what you guys are getting when you're in beta before you even brought it out to the market. So how are you guys facilitating that engagement? Are you creating content? What sort of things are you guys doing to increase that patient engagement?
Right, exactly. So there is four different things we engage. We engage with a bot. So we talk to the patient. So in this case, congestive heart failure patients. the day in life of a patient is very important. So it's an app or it's a web-based it's an app or web-based product where we created an virtual assistance to the patient, virtual companion to the patient, where Sammy is the virtual companion. Sammy will ask, Mr. Jones, time to wake up. This is the medication this morning, and the time to do your vitals. And the patient will go and stand on the weighing scale. We get their data in a HIPAA secure cloud. And same thing with blood pressure. They wear the blood pressure, and we automatically get the data to our automated cloud, HIPAA secure cloud. And same thing with pulse oximeter. They wear their pulse ox in the finger, and we get the data. They don't need to make a note of anything. The data will be acquired automatically. And once the data went through the care team to the hospital or the primary care nurse practitioners, then there are some contents where they can read about. There are videos we inject within the platform. They can better awareness of their treatment or better awareness of the condition where they are. In this case, congestive heart failure patient, they should know reducing the salt content. They shouldn't increase weight of 3 pounds a day or 5 pounds a week. And intake, what are the different foods they can take, what are the nearby restaurants for congestive heart failure patients. And there are FAQs, there are tips. Like the attention span of everybody nowadays, because of the social media, it's become more and more lesser. So we make content with 1 to 2 minutes of content, that's all, not more than that. So that's a second way of engagement. And there's a channel, HIPAA secured chat channel. The patient can enable conversation with the nurse or MA to connect with them. Number 4 is they can talk to the doctors if required with the press of a button through the chat session or the call. So everything is enabled within our platform. That's how we were able to less than 10 minutes a day, the entire day of engagement. So the patients feel comfortable. End of the day, where they started missing Sammy, that means we are successful. We are engaging with the patients much better, and less than 10 minutes of engagement a day. So it's simple to use, and they're able to connect to their the care team, and they're able to understand what the state of diagnosis they have been in right now. Right, so that's more important, and that's where we are successful in our engagement practices.
Oh, okay, that sounds pretty powerful. That's interesting. So you have patients that actually start missing Sammy, the AI nurse, who's essentially doing all the engagement with them, doing the reminders, notifications, and keeping track of all the data and whatnot. So that's kind of cool. And I know you have your background of how you got into healthcare and your business background. But when creating this platform, how did you go about putting together a team? And can you kind of speak on the team members that you had to put together in order to grow this business?
Good question. So one of the things in a startup to be successful or marching towards the finish line is the team. The team has to be your similar thinking about whether it's healthcare or fintech, in this case healthcare, where my first partner was a technology entrepreneur, Ramani Narayan is a CTO. When we joined hands together, one of the first tasks was, okay, Muthu, you are healthcare SME. I'm joining as a technology person, as a CTO. So we appreciate each other. So that link is very important. So how we build the team, the first few, I call them as a core team members. It's very, very important for a successful journey. So identifying the team, it took sometime it aligns yourself, like all the stars are aligned for a reason. I believe on that. Sometimes you have to find the right team members. I feel the CTO is the right candidate. VP of the products is very important. Sales and marketing are the first few members, and the key opinion leaders, like an advisors in healthcare. You need advisors or key opinion leaders who are physicians or the CMO candidates, who are very, very important. So that's where I was very particular in identifying the right talent who has the vested interest of an healthcare vertical is very, very important. Not just technology is not going to be solving the problem. Technology is a commodity in healthcare or any vertical rather, but in healthcare particularly, a lot of handholding is required. You need to understand like the patient experience. How can you think about a patient using this platform? How can you think about a nurse or medical assistants or physician using this platform? Because I don't know whether you know the MA and nurse works 12 hours a day in a shift, so they don't have time, and they are very busy in their day-to-day activity in the clinical practices, taking care of the patient. So it has to be simplistic form factor for them to enable this. Okay, this platform enables me to monitor 400 patients instead of traditional phone calls of 40 patients. That's a winner, right? So we are very particular in building the team and getting the right team members part of this journey. So that's where we are successful.
Awesome. And you mentioned you're getting advisors and physicians, people who have industry knowledge and can kind of guide you in the right direction. But another role that you're looking to add to the team is sales and marketing. So what role does the sales and marketing team play, and what sort of projects are they working on to help bring awareness to the platform?
Sure. There are 3 or 4 different sequence of events, right? The team. The first is the team. The second is the strategy. The strategy is team building. The sales and marketing are going key component on top of the key opinion leaders, like the CMOs of the world. The sales is marketing has to call out. If you look at our website, it's clearly articulating we are a patient engagement platform. That's a core. The core can manifest into different manifestation. Like we have because of the current COVID situation, one of the key opinion leaders or one of the physician who's been chosen as an advisor for the governor of a particular state, he picked up the phone and called, Muthu, I want Cancor to develop a COVID screening app. I'm just giving one as an example. We were able to put together a COVID screening app within less than 3 weeks. We were able to do that. He was able to take it to the state. We were able to have it piloted for 500 patients for COVID testing, which is we follow CDC guidelines. We were able to get that going. What happened after that is a marketing person took this content. We were able to publish on our social media and on our website. And the sales person was able to take this and say, how can I make use of this and say, knock the doors of all the clinics and the medical facilities in the hospital where COVID screening can be seamless, one less thing to worry about, where Cancor can help them to do the screening process with the one click. Within 32 seconds, any patients or the staff can do the screening, and they will get QR code, but they are in red state, yellow state, and green state. Green state, that means they don't have any COVID symptoms. Yellow is they have 1 or 2 symptoms. They have to check with their primary care. And red is your COVID positive, so you have to quarantine for 14 days. So one example I'm giving is we were able to quickly articulate this in a simplistic form factor because we are a patient engagement company. We engage with patients. So sales and marketing is a pillar for our company, and that's how we started engaging those 2 key roles for the company to go to the next level.
Okay. Awesome. That's interesting. And so we all know that when you are creating a company, you have an idea, you test it out, you determine whether it's product market fit, you have a go-to-market strategy, put all the right team and tools together in order to grow this. But we know that it's not an easy journey, to say the least. So can you kind of speak on the obstacles and challenges that you guys had to face either as an entrepreneur or as a company and how you guys were able to overcome that?
Yeah, sure, absolutely. One of the cycle time in healthcare is a longer cycle time compared to the sales cycle. What I meant is in an enterprise platform, in a fintech or energy, cycle times are pretty short cycle time. That means sales, if I go for a technology company in Silicon Valley, the salesperson can sell the product or services within 1 or 2 months. But in healthcare, one thing to make a note, the longer sales cycle time because of the process, because the data, we have to respect that because the hospitals and clinics deals with patient data. So there is a HIPAA regulations you have to follow. There is IT standards we have to respect and follow. That will take roughly 3 to 6 months. You have to be patient. You have to understand what you're getting into. There's a lot of different versions of healthcare industry where it's very difficult to penetrate. It's not easy to get contracts and so forth. I would argue that because you need to be patient. You need to understand what the process their IT team of a hospital is looking for, because they are being looked at very closely. If some data breach or anything happens, it's a patient data you're dealing with. So we have to support that. You have to understand what they are looking for. You have to go prepared as a team. Like, for example, our company, every single employee is HIPAA trained. We are a HIPAA secured hosted solution. We do the IT audit every 3 months. We are completely we know what the hospitals are looking for. So you need to understand the pain points, and these are the roadblocks, if may I use that phrase. But if you're trying to understand what the hospitals and clinics are going through, you're able to provide those documentations and policies and procedures. I think it's pretty simple, but you have to be very, very patient, though, right? You have to wait for a time, and you have to prove yourself. And then you're a vendor. They trust you like anything. If you're a vendor, they said, like what I talked earlier about patient engagement and how COVID screening was being brought to us, because they know that Cancor can deliver. We were able to deliver for the hospitals and clinics. So I think that's a journey, and also my recommendation to be very patient and understand the process and procedure, and be prepared for the longer sales cycle time within the hospital, clinics, and medical facilities.
Okay. Yeah, that's some good advice right there. That's a big difference between the healthcare industry and any other industry, is the length of the sales cycle and how slow the industry is to adopt new technology. So the fact that you guys are able to have a strategy to get your platform out, and you guys are aware of the obstacles and challenges that you need to overcome, that just goes to show the efficiency of your team and the knowledge that you guys possess on your board. But we're kind of coming up towards the end of the podcast. We've been talking about a lot of super interesting topics related to patient engagement and how you guys are actually getting people to the platform and engaging with your patients. But I kind of want to end the podcast with on a little more lighter note, with something I call the rapid fire round. So I'm going to ask you a set of questions, and you just give me whatever answer you come up with. Okay?
Yeah.
All right. So question number 1, what is your favorite book of all time?
I have 3 books, but the first one is The Tipping Point from Malcolm Gladwell. And the second one is Lean Startup by Eric Riel. And the third one is my favorite, Bad Blood from John Curry, which is about one of the famous startup company. Everybody should know that. What this particular book is, what one shouldn't do as a startup company, because success will come to you if you are working hard, but also success will march on you. That means you have to be very careful in walking through that thin line of success. So that's something I recommend very strongly about Bad Blood, about a very famous company which went in the wrong direction with not the proper management team. So.
Oh, interesting. Okay, who is the most influential person in your life or career?
Very good question. There are three people which I go through category into simple. I read a lot about a gentleman called Mr. Kamaraj. Is he passed away a long time ago, Chief Minister of Tamil Nadu, India. He was very simple but very respected congressman in India. In coming from a small village, he was a statesman. He's a kingmaker in a Congress party at that time. And number two was my close friend, and I consider him as a very valuable friend. Madhu Nutaki is currently the CIO of the innovation of Nissan. Very strategic person. So I took I look up to him when we were rolling out Epic system at Kaiser. Very strategic person. Number three is the current person is the chairman and CEO of Zoho Systems, Mr. Sridhar Vembu. He's a visionary. The example for visionary is this gentleman. He has taken the company without a single VC money, completely privately owned, taken to places where nobody can imagine. The company name is Zoho, Zoho. He's the president and CEO of the company.
Okay, excellent. What is one goal you want to accomplish this year?
By end of December, I want to get 1 million ARR, which is 1 million ARR for Cancor Health, which looks very, very promising. We are marching towards that big milestone.
Awesome. Last one. What is one piece of advice you would give to your 20-year-old self?
Entrepreneur journey is very, very interesting. You need to believe on it. Success don't come very, very easily to you. You have to work towards it. You have to believe on the goal. A lot of patience. You have to be very, very patient in terms of achieving the goal. And the journey is very, very interesting. The simplistic way is we are 4 years now. If we turn back, yeah, we did a lot of mistakes as a team, but a lot of learnings. The learnings in Silicon Valley on entrepreneurship is amazing. You can't get anywhere being in an enterprise scenario. So entrepreneur journey, you believe on the idea, you trust on your team, and you be patient.
Awesome. Excellent advice. Perfect way to end today's episode. Muthu, I just want to say thank you again. We talked a lot about what you guys are doing at Cancor Health as the president and CEO, and how you guys created the AI-enabled patient engagement platform, and what you guys are doing to increase patient engagement and making the experience a lot better. And just want to say thank you again for jumping on and just sharing your story, sharing your knowledge, the ups and downs of being a business owner and entrepreneur.
Thank you, sir. Really appreciate it, Rod. This means a lot. And thanks for providing this environment for me to share my experience. Really appreciate it. Thank you so much.
No problem. And last thing before we go, where can people learn more about Cancor Health, and where can people connect with you?
Cancor Health, www.kencorhealth.com. We are in LinkedIn and Twitter and Facebook, cancorhealth.com. And my name is Muthu Krishnan. I'm available on LinkedIn. And also you can reach out to me at muthu@cancorhealth.com.
Awesome. Perfect. Well, that ends today's episode. I'll catch you guys on the next one. Thank you.
Thanks for listening to today's episode of Health Tech Hustle with Rodney Hu, founder of 209 Digital. Tune in next week for another interview with an expert leader in digital health.